So basically in anatomy, you will see that we have multiple sub-subjects, okay? So in anatomy, what we see the structure of human body. And you will see that in multiple years of MBBS. So there are how many subjects in MBBS total? Anyone? 19 subjects. What are they? Anyone? You know? Biochemistry. Okay. Second? Anyone? In second year? Pharmacology, microbiology, pathology, and 3. Na? In third year? Forensic medicine, then community medicine, then ENT and ophthalmology. What is the other name for ENT? Anyone? Otorhinolaryngology. Okay. In final year, we have rest of the subject, that is surgery, medicine, and other subjects. Okay. So you will see that anatomy, since you have entered this MBBS course, you will see that anatomy will haunt you for the rest of the life. Okay. That is the basic thing. You cannot run away from anatomy. You can run away from other subjects, but you cannot run from anatomy. So this will be haunting you, and this is one of the most toughest subject. That is the harsh truth from the first day I am telling you. This is going to be one of the the toughest one for the first year at least. And after, in subsequent years, you will see that things are getting a bit easier. So don't be afraid of the subject. Sometimes you will see that you have to memorize a thing multiple times. You will see that a topic is very big, but only one question is being asked. That is also like one time in the whole year. So, but you have to study, because you don't know that whatever will be asked or not. What will be asked or not, you don't know. So for this, you need to follow the previous year question papers, which you will be getting from the Tripura University, and from also the college question papers that you will be getting from your seniors. Okay, fine. So you will see that in anatomy, we mainly discuss about gross anatomy. Okay. In gross anatomy, we will have the lecture classes where we will be discussing the different parts of anatomy. That is what is there in upper limb, what is there in lower limb, and in brain, neuroanatomy, abdomen, pelvis. Those are the topics that we will be discussing in gross anatomy part. And other than this, in gross anatomy, we will also be having the dissection classes. Okay, where we will see the structures and we will correlate them with our textbooks. Okay. Now, the next part is your osteology. In osteology, logy means to study, right? Osteo means bones. So here we study the bones. Basically, we will be having the idea of the whole skeleton. By the end of the first year, you will be knowing the names of all the bones and their features, each one of them, and their side, it is right-sided or left-sided, then their movements, what are the muscles are attached, then what are the nerves that supply to the muscles that is present in those bones. By the end of this first year, you are going to memorize or learn all these topics, right? So then in histology, we generally discuss about the tissue. Tissue means a group of cells together form tissue, right? So in tissue, we will be sectioning, like we will not be doing the procedure. We will be having certain slides, and by seeing them under the microscope, we will decide whether it is a connective tissue or a epithelial tissue or a bone tissue or a muscle tissue. That thing we will be discussing, determining by seeing them under the microscope. That is the part of histology. And in embryology, we will be studying about the various developmental things, like how the heart is developed in the embryo, how the brain is developed, how our neuropores are developed. These things we will be discussing in our embryology part. And that's all in the whole anatomy part. Now, why I told you that anatomy will be haunting you for the rest of your life? Because in MBBS, when we entered the MBBS course, the main thing is we need to make one diagnosis, and on the basis of those diagnoses, we give treatment, we provide treatment. Now for treatment purpose, we usually follow medicine, surgery, these things. Okay, so whatever, there can be some treatment can be medical treatment, some treatment can be surgical treatment. Now in surgery, we can be having ENT, ophtha. If it is related to our eyes, then it will be ophthalmology. Then if it is related to our ear, nose, these things, then it will be coming under ENT. If it is related to a child, then it comes under pediatrics. All of them comes under medicine and elite subjects. Okay. Now, in surgery we have ENT, ophtha. In medicine we have psychiatry, derma, pediatrics, these things. So, but to know this structure, we first need to diagnose those things. For diagnosis part, we go back to pathology, microbiology, biochemistry, these things. But to diagnose a disease, we have to have the understanding of the normal position of the organs and the various structures in our human body. Those things are taught under anatomy. So whether you are studying medicine, whether you are studying surgery, you will need to have a basic or a broad understanding of anatomy. So up to the final year also, you will have to have the understanding of anatomy, and anatomy is very tough. That is main thing. And we as a department, we assure you that if you are good with us, then we will be the best department. You can ask your seniors. We have been the best department. We have provided every help that we can do from our side to our students. Our HOD sir is very good. All our faculties, we try our best to do these things. But you should have the basic respect and the basic understanding that what we should say to our teachers, what we should ask our teachers. We can ask doubts to our teachers, but we cannot question them. Okay, but we can have certain arguments. That is a different thing. But we cannot question them that you have taught this in book. It is not written, but I know that this is the answer. That is not an argument. That is a questionable topic. So you cannot do these things. Okay. So other than this, you will be treated very good. And we are starting our session. So in the first, I want to show you certain books. See, this is the Bible of Anatomy, Gray's Anatomy. You all know. How many of you have bought this book? This is a very costly book. You have bought this book, na? Anyone? You have bought this book. Got it from senior, right? So this book, you can keep it aside. Don't follow it blindly because it is an international book. Okay. Since it is an international book, so some of the things are not necessary from our Indian perspective. Okay. How they are not necessary? They are not necessary in our CBME guidelines. So by National Medical Council of India, there is a certain guideline by following which we determine our syllabus. So in Gray's Anatomy, everything is given according to international standards, but from Indian perspective, we generally follow either BD Chaurasia or our Vishram Singh. Okay, these two books. You can go to the library. There you can see the Gray's Anatomy in the central library. You can see the BD Chaurasia books and Vishram Singh book. So for textbook purpose, we will be following you have to study BD Chaurasia or Vishram Singh. Maximum almost 80 to 90% of the topics that will be asked in the question paper will be from these two books. I mean these two authors. Okay. Either of them you can buy. Both of them are same thing only, just different authors are there. Here you can see in volume 1 there is upper limb and thorax. In volume 2 we will also understand today that what is upper limb, what is thorax, these things. In volume 2 we have lower limb, abdomen and pelvis. In volume 3 we have head and neck. In volume 4 we have neuroanatomy. These are the 4 volumes. Similarly in Vishram Singh also you will see in volume 1 there is upper limb and thorax. In volume 2 you have abdomen and lower limb. In volume 3 we have head, neck and brain. Here there is no volume 4 because the brain part is in volume 3. So these two authors we follow throughout India. Now for general anatomy part, 1 or 2 questions you will be expecting from general anatomy. You will be having one class tomorrow that will be taken by our HOD sir, Akhtaruzzaman sir. So he will be taking a bones class, features of your long bones. So that will be a part of your general anatomy. So for general anatomy also again, there are 2 books. One is by BD Chaurasia, another one is by Vishram Singh. Any one you can buy. Don't buy both the books, just go to the library, see all the books that are present there. Whichever you find comfortable with the language, just buy that book. Now coming to osteology, we generally follow Indarveer Singh Human Osteology, but you can follow any book. At the end of the day, you need to answer the questions that are asked. Everything is written same in all the books. Now in embryology, we usually follow Indarveer Singh again. Then again for histology also, your Rishabh sir will be telling you like this, the class will be taken after this class. So human histology by Inderbir Singh. Then there are certain dissection manuals by Cunningham. Okay, so it is Cunningham. You will see that there are 3 volumes. Right now you can buy volume 1 and volume 2 only, or else just volume 1 for this first semester, because upper limb we are starting and we will also be starting with thorax most probably. So if upper limb and thorax, then you can buy these 2 books, or you can buy all 3 of them together. So this is Cunningham dissection manual. Here you will see all the structures one by one properly, so that you can understand them in the cadaver. Now coming to an extra book, this is your Natter Atlas of Human Anatomy. This is also an international book, so it has a lot of pictures. So those pictures will be very much helpful if you need them. So that's all from books part. Now if I have to say that right now what book you should buy for your exams or for your classes, you can start with only either of these books. Either these books or these books. Like, it is not necessary that you have to buy all these Vishram Singh books together or all the BDC books together. You can buy upper limb for BDC or lower limb for Vishram Singh, like that also you can buy. You can buy both the volumes also, or you can also take them from the library. But start from these books. In these books you will see that already osteology is given. Then dissection part is also given. Okay, these things are given in these books. Then radiology part is also given. Yes, we also study surface marking and radiology. That will be by the end of the session, not right now. And there will be 5 marks question from those topics also. Okay. So radiology also comes under anatomy part. Now these 2 books you have to buy first, and 1 general anatomy book. These 3 books you buy. Osteology you can buy later on. You can also choose to not buy. And these things also your subsequent teachers will be telling you. Okay. Now let us have certain basic understanding of the anatomical terminologies. So in our body there are certain parts. If you see this skeleton, you will see that here this is a portion, this is another portion, this is another portion, and this is another portion, right? So this is your head part. Okay, this is your head part, this is your face part. Okay, and this is your neck part. Then comes your trunk part. In trunk you will see this thorax and abdomen, right? Here you will see the pelvis part, where our genital organs are present, as well as our urinary bladder. Now this portion is your upper limb. Okay, so we have 2 limbs. This one is your upper limb and this one is your lower limb. Okay, this upper limb is further divided into forearm, arm and your hand. This portion is your forearm, arm. This portion is your arm, which comprises your humerus bone. So this is your humerus. And this part is your forearm. This part comprises your radius and ulna bone, right? And here is your wrist joint. This part is your wrist joint, and this is your hand, which has your metacarpals, carpals and phalanges. Okay. Now coming to lower limb, so this part is your thigh. Okay, this is the thigh and this is the leg. This is leg and this is foot. Okay. In thigh we have femur. This is the femur bone. In leg we have tibia and fibula, and this small bone is patella. Here we see this foot bone. In foot we will see calcaneum, talus, navicular bone and metacarpals, that is metatarsal, right? And other small bones we will see. In thorax we will see these ribs. These are the ribs. This is the sternum. Then in the posterior part, we see this vertebral column. That vertebral column you can see. Then in the abdomen, there are roughly no bones anteriorly, but posteriorly you will see floating ribs. And in the posterior part, the vertebral column also continues as your sacrum and coccyx bone. Then there are your hip bones. We will go through these bones throughout the year, one by one. So this is the skull bone. In skull, we will be discussing the multiple structures in subsequent classes. So now there are certain points. So you have been taught about the anatomical position in the morning. Anatomical position. Okay. So now other than this, there are certain other terminologies. Do you know anterior, posterior? So right, left. Okay. So that is lateral and medial. Okay. What is medial? Close to the body, right? And lateral means away from the body. Okay. What is proximal? Towards the body. Okay. It is also towards the body. So and distal means away from the body. Okay. So medial means medially, towards middle portion of the body. Lateral means away from the middle portion of the body. And proximal is also like this portion is proximal to my body, this portion is distal to my body. Okay. This is anterior part of my body, or also known as the ventral part. Okay. Then dorsal part of my body, also known as the posterior part. Then superior, inferior, oblique. Then there are certain planes, sagittal planes, coronal planes. What is the sagittal plane? Right and left halves. Okay, that is the sagittal plane. In sagittal plane also, the most important plane is your mid-sagittal plane. That is passing through the middle portion. Then there is your coronal plane, that is dividing the body into anterior, posterior halves. Right. So today we will be studying about the clavicle. So what is the other name of this clavicle bone? Collarbone, right? So can you show me which one is the clavicle? Last. You know? This one. Which one? You. Which one? Yes. This is the, so this is our clavicle. Okay. Also known as the collarbone. Right? So this bone, if you see, this is a S-shaped bone. It is in the shape of S. Okay. And curved in its whole structure. Right? And do you know why animals cannot walk? They can only walk in their they can walk in their four legs, but they cannot stand. Why? Because they don't have clavicle. We have clavicle. Animals don't have clavicle. So what this clavicle does, it provides a structure, a support of division between our trunk and our upper limb. What I mean to say that this part, if it is not present, then these two would have been in the front like this. Okay, would have been in the front like this. But because of this bone, this clavicle, we can place our hands on our two sides. Okay, like this. So that is why this is one of the reasons that we can do works with our hand, but animals cannot do. Okay, so that is one part. Now, while studying osteology, there are certain points which we need to know. First of all, we have to identify the bone. Examiner will ask you that what is the name of this bone. Then the further question will come that determine the anatomical position of the bone. Anatomical position means how it is present in our body. Whether it is present in the right side or it is present in the left side. How to determine that thing. Okay. So there are multiple bones in our body. So that is why we need to determine which one is the right sided, which one is the left sided. Now the third point is regarding your muscle attachment or attachments. So in attachments you will see bony the third point will be your parts. So a bone has multiple parts. Okay. Similarly, after these parts we need to know the attachments. That is the medial part attaches to which bone, lateral part will attach to which bone. These things we will understand. Then comes muscle attachment, that what muscles gets attached in this bone. And then we will study the ossification centers. And at the last, we will study the applied anatomy, that is what will happen if there is fracture of this bone like this and that. Okay, so let us continue with the clavicle. So it is also known as the collarbone, as shaped located horizontally on the anterior portion. Don't write these things are present in your book. So located horizontally on the anterior aspect of the body at the junction of the root of the neck and the beginning of our trunk. So from here our trunk begins and this is the neck. So this is the root of the neck. So from here this clavicle bone begins and this is our trunk portion. Okay. So it articulates medially with the sternum bone and first rib cartilage and laterally with the acromion process of the scapula. So this is scapula bone. Okay. So this is your scapula bone. Scapula bone has certain processes. Don't click pictures. So this is your coracoid process. This is your acromion process. These things will be taken in the subsequent classes also. Acromion process, and this is the spinous process. So this scapula has acromion process. With this acromion process, the medial part, lateral part of the clavicle attaches like this. Okay. Now this is the sternum bone. Okay. This sternum bone has again three parts: manubrium sterni, your body, and the xiphisternum. So this clavicle, its medial part attaches with the sternoclavicular joint. Sternoclavicular joint. So there is a fossette, a oval facet or fossette, anything you can say, a depression. In this depression, this bone gets articulated like this. Now see here you will see this is the sternum bone. So in the sternum bone, in the medial, this is the clavicle bone. This bone is articulating with the clavicular joint in the sternum. And on the posterior part, that is the lateral side of this clavicle, is articulating with the acromion process of the clavicle. See it properly here. So here you will see that this is the clavicle and this is the sternum. So this sternum, here you will see one clavicular notch in the sternum, clavicular notch. So clavicular notch means a notch for the clavicle, that is not the bone. So it's a notch for the clavicle where the medial end of the clavicle articulates. And the lateral end, this is the lateral end, this is articulating with the acromion process of the scapula. So this is the scapula bone and this is the acromion process. This part, small part, is your acromion process of the scapula. So in this way the bone is present in our body. It is a subcutaneous bone that is present beneath the skin and hence cannot be palpated throughout its entire extent, because in the lateral portion it gets covered up by trapezius muscle and pectoralis major muscles. So that is why it cannot be felt throughout the way. In the beginning you can feel the clavicle bone, but at the end you cannot feel it properly. Okay. It is only bony attachment between the trunk and the upper limb. So the connection between the upper limb and the trunk part is only this bone. Only this bone is connecting both this structure together in our body. Now the functions. So I have already discussed this function. It acts as a strut for holding the upper limb far from the trunk so that it can move freely, which is not present in case of animals. This allows free swing of the upper limbs for various prehensile acts such as holding, catching. It transmits forces from the upper limb towards the lower limb as well as the trunk. Okay, it helps in transmitting our weight throughout the body, mainly towards the axial skeleton. So in our body we have axial skeleton and appendicular skeleton. So the middle portion of our body comprises of our axial skeleton. Okay, the limbs, that is the extensors part, comprises our appendicular skeleton. It provides an area for attachment of the muscles. Now there are certain peculiarities. So if you see properly, it is a bone. It is a long bone. So there are certain bones in our body which we define them as long bones. So there are certain features of long bone which you will be studying in the in tomorrow's lecture class. But there are certain peculiarities for this clavicle. So if you see in our body, all the long bones are present vertically. Okay, be it our humerus, our radius, ulna, it is present like this. None of the long bone is present horizontally. Only clavicle is the only bone which is present horizontally, right? And it has no medullary cavity. All the long bones have medullary cavity. What is medullary cavity? It is a hollow space in the bone, in the middle portion of the bone. So if you have taken mutton, you will see properly those hollow spaces. So that is the medullary cavity. It contains certain cancellous bony structure and other nutrient components, as well as the blood supply also passes through this portion only. But here you will see no medullary cavity. It is subcutaneous throughout its extent. It is the first bone to ossify, that ossifies roughly 3 to 6 months in the beginning, and it is also the last bone to complete its ossification. So 5th to 6th week of intrauterine life, 5th to 6th week of intrauterine life. So what is intrauterine life? It is inside the mother's womb. So in the mother's womb, a baby has to pass through 9 months. So in the first 5 to 6 weeks of intrauterine, understand the term intra means inside. Okay, intracellular means inside the cell. Intercellular means within the cell, within two cells, that is intercellular. Intracellular means within, inside the cell. Similarly, intra means within, and intrauterine means within the uterus. Uterus is a female organ, you all know. So uterus is a female organ. So in the 5th and 6th week of embryo development in the intrauterine life, the first ossification of the clavicle begins, and it gets completed by 25 years, that is at the end of all other long bones. Okay, so what is ossification? So in a bone there are certain centers, we call them primary centers, secondary centers. Okay, so through this center, the epiphysis, diaphysis and metaphysis, all the three parts of a bone gets developed. Okay, so there are certain primary centers and secondary centers. Usually the primary centers develop before birth, and secondary centers develop after birth. Okay, so that is ossification. It is the only long bone which ossifies by two primary centers. Usually there is only one primary center. In case of long bone, I am telling, in case of long bone there is only one primary center, but in case of your clavicle there are two primary centers. It is the only long bone which ossifies in membrane except for its medial end. So in the medial end it is more of like cartilaginous covering, but in most of its its extent it is covered by membrane. Okay, in case of long bones they usually ossify in cartilage. It may be pierced through and through by cutaneous nerves such as intermediate supraclavicular nerve. Okay. Now coming to the parts. So do you have any idea about surfaces and borders? Like this bone seems like a cylindrical bone. Okay, completely cylindrical. How can it have multiple parts? Okay, so in case of this is the surface. Okay, this is the surface, and these are the borders. Okay, these are the borders. Similarly, in these bones also we have certain surfaces and borders. First of all, let us know the two ends. One is the medial end. So this is the medial end. This portion is your lateral end. Okay, so this portion is towards the middle portion of the body. This portion is away from the middle portion of the body. Now, and it has a shaft. So this is shaft. This whole part is shaft. So medial end, lateral end and shaft. By the way, you know that this is a real bone, na? All the bones are not real, but this is a real bone. For example, this is not real. You have got the bones, na? All of you. some of you, so try to collect it from your seniors, okay, or else you will be facing difficulties to study, because in case of fiber bone, or else if you buy fiber bone, try to buy them like properly. Like what I meant by properly, try to see the ratings and everything and then decide whether you will buy or not, because in fiber bone all the structures will not be there. If you see a fiber clavicle, you will see that there are multiple tubercles groups given here and there which are not perfect in our body. These are not present in our body. See, that is the sternal end, that is the medial part. This cylindrical round part is the sternal end, which is present medially in our body, and this quadrilateral flat part is present laterally. This is the acromion part or the acromial end. Okay. So this is the sternal end. Then the lateral part is your acromial end. Now coming to the shaft. So the shaft is curved in nature. It has a medial part and a lateral part, and the medial part, as I have already told, this is round. The medial part is round, but the lateral part is flat. So this is the lateral part. This lateral part is flat. Okay, medial part is round, and this medial portion comprises 2/3 of the shaft, and this lateral portion comprises 1/3. If this is the whole shaft, this 2/3 is the medial part, 1/3 is the lateral part. Okay. Now this lateral part is flat and concave forward. Okay, this concavity is forward, and this convexity of the medial part is again forward. So how to determine whether it is a right or left is, if you do like this, you will see that the medial part is becoming concave. So this is not the right way. So you have to show to the examiner like this. So this is the anatomical position where you will see that the medial portion is convex, and this lateral portion is concave. Okay. Similarly, the lateral portion you need to confirm by seeing the flat surface. This is the flat portion of the clavicle. Similarly, the medial portion has round contour, round texture, right? And whether it is right or left, we will see in multiple slides. Now, coming to the anatomical position, the side of the clavicle can be determined by holding the bone horizontally in such a way that its flattened end is on the lateral side. So this is the flattened end, it is on the lateral side, and its enlarged quadrilateral part is on the medial side. Okay, the convexity of the medial 2/3 and concavity of the lateral 1/3 is facing forward. Okay, with a longitudinal groove in the middle third of the shaft facing inferiorly. So if you turn the bone like this in the inferior portion, so if this is the bone, this is the medial side, this is the lateral side, this is the superior, and this is the inferior. Now I am turning the bone and viewing from beneath, from below. Okay, here you will see one groove, one depression. This is your longitudinal groove. Okay, it should always face inferiorly. This is the main point. Or else you will say that I can do like this, then it becomes the left-sided clavicle, because here also the medial end is quadrilateral, lateral end is flat. This portion is anterior, that is the convex part, and this portion is concave, so it is becoming the left bone. Similarly, in this way, this is becoming the right-sided clavicle. But this is not the case, because the longitudinal groove has to be below, inferiorly. It cannot be superiorly. If I do like this, it becomes a superior part. Okay. See, if you turn it like this, you will see the longitudinal groove. See, this is the longitudinal groove. This portion. So this portion is the longitudinal groove. Groove means a depression. Okay, this depression is present inferiorly of the clavicle, also known as the subclavian groove. And here you will see one tubercle. This tubercle, this is your conoid tubercle. See, if you keep the bone like this in the inferior part, you will see here is a tubercle. This is the conoid tubercle. Okay, this is the conoid tubercle, and this is the medial end, this is the lateral end again, this is superior, inferior. Now anatomical site determination is clear for this bone. Okay. If it is not clear, you can ask. Okay. Now coming to the features and attachments. So the lateral end, also known as the acromial end. Why it is called acromial end? Yes, it attaches with the acromion process of the scapula. Okay, that is why it is known as the acromial end. It is flat above downwards. An oval facet on this end articulates with the facet on the medial margin of the acromion to form acromioclavicular joint. In simple words, this is the acromion process. It joins like this to form the acromioclavicular joint. So this is the acromioclavicular joint. They have explained it like there is a notch, a depression, oval facet. Here is another protrusion. Together they join like this for this joint to form. That is your acromioclavicular joint. Acromioclavicular joint. Okay. The lateral end provides attachment to fibrous capsule of acromioclavicular joint. So in further classes you will see there is a fibrous capsule. Okay, this fibrous capsule is protecting this portion only, this acromioclavicular joint only. Okay. Now the medial end or the sternal end. So in the medial part, this portion is enlarged, and it is also, again I have already mentioned that it attaches with the sternal end that is present in the manubrium sterni and forms the sternoclavicular joint. Okay, which provides attachment to again fibrous capsule and articular disc and interclavicular ligament. Just forget these things for now. Simply understand this, that this clavicle and the sternum together they form the sternoclavicular joint. Now coming to the shaft. The shaft of the clavicle is divided into two parts, lateral 1/3 and medial 2/3. I have already told you the medial 2/3 is convex forward, lateral 1/3 is concave. Now coming to the lateral 1/3, now coming to surfaces and borders. Do you have any paper, excess paper? See, in a normal rectangle or any normal surface, we have surfaces. These are the surfaces and these are the borders. But how can these have surfaces and borders? This is appearing to be circular in nature or cylindrical in nature. So these bones are not in rectangle or in any other form. So if we do this like this, now it has multiple surfaces and borders. So here there is one border, there is one border, in between this border there is one surface. Similarly, here also there is one border, here is also one border, and in between them there is a surface. In this way, in a bone there are multiple small borders, and in between them the flat areas are the surfaces. The sharp edges are the borders, the flat areas in between them are the surfaces. Now in the lateral 1/3 from above downward we have two surfaces. See, from above downward we have two surfaces. So if clavicle is present like this, so there is one superior surface and one inferior surface. Superior surface and inferior surface. Two borders, anterior border, posterior border. Now the superior surface is subcutaneous between the attachment of deltoid and trapezius. Leave it. So there is one muscle here. So have you taken vaccine? All of you have taken vaccine. We usually take it in the deltoid muscle. So here is your deltoid muscle. Those who do gym, you guys know. So this is the deltoid muscle, and here you will see trapezius muscle. Okay, this trapezius and this deltoid is present on the lateral end. Okay, basically on the superior surface of the lateral end of the clavicle. In the inferior surface, it presents a conoid tubercle. We have seen the conoid tubercle. So it is present in the inferior surface, and a trapezoid ridge, which provides attachment to conoid and trapezoid parts of coracoclavicular ligament respectively. leave these things. You will like mug it, like get confused over these terms, because these things you will find it difficult to understand when we will be studying the individual ligaments and the muscles. At that time, in the lateral portion we have anterior border, posterior border, superior surface, inferior surface. This superior surface we have attachment for our trapezius muscle. Inferior surface we have deltoid tubercle, where there is attachment for our deltoid muscle. Then there is conoid tubercle in the inferior portion, and there is a trapezoid ridge. Then posterior border, anterior border. So there are two borders, two surfaces, that much you understand. Now coming to the medial two-third, it is cylindrical in shape and presents four surfaces: anterior, posterior, superior and inferior. So there are no borders since it is a cylindrical in nature. This medial portion is cylindrical in nature. So it has surfaces: superior surface, inferior surface, anterior surface and posterior surface. There are no borders. Okay. Anterior surface is convex forwards and gives origin to the clavicular head of pectoralis major muscle. So you will see one muscle here present like this. This muscle has its attachment in the anterior portion of the medial end. Okay. So in the anterior surface, this pectoralis major muscle comes like this, a fan shaped muscle it is. So it has attachments in the medial two-third of the clavicle. Posterior surface, it is concave backwards and gives origin to sternohyoid muscle near its medial end. So these are muscular attachments. So it is concave backwards and give attachments to sternohyoid muscle. So sternohyoid is a muscle that comes, that is present in between the sternum and the hyoid bone. So here is our hyoid bone and this is the sternum. In between them there is a muscle known as sternohyoid muscle. So it is basically present in the posterior surface of the clavicle. Now the lateral part of this surface forms anterior boundary of cervicoaxillary canal. Leave this thing. Cervicoaxillary canal is basically in the axilla. Whenever we will be studying the axilla, it is a truncated structure like this. Okay, so the axilla is a truncated structure like this. It progresses above as a cervicoaxillary canal. So all the structures, all the nerves here comes through this cervicoaxillary canal and supplies our hand like this. Okay, through this way. Okay, so that is the cervicoaxillary canal, and it is present in, and it also passes through the posterior surface of the clavicle. So this is the clavicle. Let us finish these things. So in the superior surface, the clavicular head of sternocleidomastoid muscle originates from the medial half of the surface. So from the medial half of the superior surface, here one muscle originates, that is your sternocleidomastoid muscle. Can you show me the sternocleidomastoid muscle? So this is the sternocleidomastoid muscle. Here one muscle you can feel. This muscle is your sternocleidomastoid muscle. So it is originating from the sternum end of the clavicle as well as the sternum, then going up to the mastoid process. So this is the mastoid process. So together this muscle is our sternocleidomastoid muscle. Okay. Now the inferior surface, it presents the following features. It has costoclavicular ligament which is attached to an oval impression at its medial end, and a subclavius muscle insertion and a subclavian group. So in the inferior surface we have attachment for costoclavicular ligament and subclavian muscle attachment in the subclavian group. Then clavipectoral fascia is attached to the margins of the subclavian group. Nutrient foramen of the clavicle is located on the lateral end of the subclavian group. So basically in the inferior surface of this medial end only, there is one subclavian group here. This is your subclavian group. In this subclavian group there is attachment for the subclavius muscle, and just medial to this is our nutrient foramen. So whenever you will be studying long bone, here you will see that there is one nutrient foramen. So nutrient foramen of the clavicle is present medial to this subclavian group. These are the various muscle attachment as I have already mentioned. So in the posterior surface you have attachment for the trapezius, and in the anterior surface in the deltoid tubercle for the deltoid muscle there is attachment. In the medial part you will see pectoralis major muscle attachment and sternocleidomastoid muscle attachment. Then again in the medial part, you have pectoralis major muscle attachment, basically on the posterior surface. Then in the subclavian group, for the subclavius muscle, deltoid muscle. So these structures, these are not the muscles, these are the like origination or insertion of the muscle. Basically, whenever we show this red color or pink color in our textbooks, it usually means origination. Origination means a muscle can either begin its journey from this bone or can get inserted in this bone. Both the things are possible. Either it can begin its journey from this bone. For example, pectoralis major muscle, it begins its journey from this bone. But in case of trapezius, you will see that it gets inserted in this bone, because the trapezius muscle basically begins from our nuchal lines. Okay, so it gets inserted in the clavicle bone. It does not originate from the clavicle bone. Now, as I have already mentioned that there are two ossification centers, primary ossification centers, and mostly the ossification of clavicle is membrano-cartilaginous in nature. So basically, in case of long bone, the ossification occurs in the clavicle, but in case of, cartilage. But in case of clavicle, the ossification occurs in the membrane. Some of the ossification, almost all of the ossification occurs in the membrane, just the medial part, it ossifies from the cartilage. So the ossification of clavicle is membrano-cartilaginous. Whole of it ossifies in the membrane except its medial end, which ossifies in the cartilage. The clavicle begins to ossify before any other bone in the body. It ossifies by 4 ossification centers, 2 primary for the shaft and 2 secondary centers, 1 for each end. So there are 2 primary centers for the shaft. You will see here. Okay, I have not kept the picture. So there are 2 primary ossification centers for the shaft and 2 for either ends. The 2 primary centers appears in the 5th to 6th week of intrauterine life and gets fused by 45th day of intrauterine life. Secondary center at the sternal end begins appears at 19 to 20 years of age, and it gets fused by 25th year, and the secondary centers at the acromial end appears by 20th year and fuses immediately. What it meant to say that there are certain centers, through these centers this whole bone develops. So if your age is below 20 years, there is a probability that your clavicle is not fully developed. Okay, if your age is below 25, then also there is a probability that your clavicle is not fully developed. It gets completely developed after 25 years of age in case of human beings. Okay, so how it gets completely developed? Through ossification centers. So there are certain centers which helps in ossification process, that is formation of bone process. Okay, so that is defined as primary centers or secondary centers. If it is called primary center, then we are talking about intrauterine life, that is before birth. And if we are talking about secondary centers, then it is forming after birth, that is post delivery. So as you can see, the sternal end or the medial end ossification centers developed by 19 to 20 years of life, and it is 2 years earlier in case of female, and all of them gets completely fused by 25 years. Now there are certain clinical correlation. For example, clavicular dysostosis. So it is a clinical condition in which the medial and the lateral end does not fuse with one another. Okay, they remain separate due to non-union of 2 primary centers of ossification. So since there are 2 primary centers at the shaft, they don't ossify with one another, so they remain separate. We will see one picture of it. Then Cleidocranial dysostosis. So it is defined by partial or complete absence of clavicle associated with defective ossification of the skull bones. And then fracture of clavicle. So we have studied 3 things. One is your clavicular dysostosis, where there is this medial and lateral part of the bone does not ossify and the clavicle remains as a separate bone. So this like this separate. Then cleidocranial dysostosis. Here you will see that the clavicle is not present in the bone, that is why cleido, and cranial means there is some developmental issues with the brain, that is why cranial. So cleidocranial dysostosis. Then finally fracture of clavicle. So you will see that during delivery some of the babies get fracture of the clavicle. So while delivery, this clavicle gets fractured. So what will happen if fracture occurs? So there is a very strong muscle present here, that is the sternocleidomastoid muscle. It will pull the clavicle upwards. So the clavicle will be pulled upwards and this portion will be present below. Okay. See this picture. So this baby is not having any clavicle. So this is cleidocranial dysostosis. That is the same thing that is present in case of animals also. So their hands are like this. That is why they cannot do like this. Okay. So that's all in clavicle. In next week we will be having a revision class. Okay.